Hi all, welcome to Viva Codes. So today we are going to see what is a clinical indicator, and in upcoming sessions we will be seeing what are all the clinical indicators for each of the condition. Okay, what is first of all a clinical indicator, by the way? Clinical indicators are certain signs, symptoms, or even some conditions which represent or which serve as an indicator for some conditions. Okay, in order to put in layman terms, for example, if we are having some sore throat, fever, and running nose, okay, we will have an assumption, okay, I have a fever now, some viral fever or whatever it is. I have a fever now, maybe let me go to doctor. So based on what you're going to doctor, based on the your assumption, based on the symptoms you have, right? Based on fever, based on sore throat, based on the runny nose, you have come to a conclusion, maybe I have some abnormality with my body, which could be a viral fever or some other fever, so that let me go to the doctor. The same thing applies for the chart also. So here these three conditions, that is these three signs and symptoms helped you to go to doctor to find out the condition. Likewise, there are certain set of clinical indicators for each and every condition. That is what we call it as clinical indicators. You just split the word and see. That is clinical and indicators. Clinical plus indicator means what? It will indicate something. What it is indicating? The disease condition, underlying disease condition. Why I have got this symptom. Okay, that is the clinical indicator. Okay, why I should use this clinical indicator? Because clinical indicators are used to raise query in the chart. Okay, basically clinical indicators are used to raise query in the chart. Okay, what is the raising of query? Means if suppose I'm having a doubt, okay, I will be raising query to the physician stating these many symptoms are there, whether this patient have a certain condition or not. Okay, based on the symptoms, I'll ask the provider whether this patient has some symptoms like some conditions or not. Okay, it will be helpful in that. And also it is used for the confirmation or cross verify a diagnosis. Means, for example, if suppose there is a condition, example sepsis, let us take. Okay, so what happens is that if there is sepsis in the chart, also we will see the supporting documentation to code the sepsis. We will not just blindly go and code a condition in a chart. We should see, oh, whether this patient has fever, whether this patient have tachycardia, tachypnea, or whether this patient have any blood culture positive, or whether this patient have any confusion or increased WBC or immature neutrophils, or any one of these indicator is present. Not any one, at least four indicators need to be present in order to code a, like, or either to query a physician or to code a condition or to cross verify a condition. We need at least four indicators for a particular diagnosis. Okay, so these are all the things where clinical indicators are very much useful to raise a query, to confirm or cross verify a diagnosis. Okay, next, each of the disease condition has their own clinical indicators. Yes, because I already told you, right? For viral fever, there will be some set of symptom. For sepsis, there will be some set of symptom. For like for aspiration pneumonia, there will be some set of symptoms. Okay, maybe one or two symptoms may coincide commonly for all the conditions, for most of the condition, but there will be some specific indicators for a particular condition also. Okay, so today we are going to see what are all the clinical indicators for sepsis. Okay, so here are the clinical indicators. See, when a patient has sepsis, these things, not all these things, any of these things, at least two, at least 3 to 4 of these things which will be there in the chart, and it should be there in the chart. Only then you can come to a conclusion, okay, this patient has sepsis. Such clinical indicators are fever or hypothermia, tachypnea, tachycardia, increased WBC, confusion or disorientation or altered mental status, hypotension, acute organ failure or dysfunction, metabolic acidosis, acute onset of confusion associated with the disease process or AMS, that is altered mental status, shock, positive blood culture, localized infection, that is UTI, pneumonia, cellulitis, wound infection, oliguria, IV broad spectrum or empirical antibiotics, organism specific antibiotic, elevated procalcitonin, lactic acidosis, metabolic acidosis. Okay, should I see all these symptoms in order to code the sepsis? No. Any of at least 3 to 4 symptoms is more than enough that this condition is present. Okay, why I'm going with 3 or 4? Why not it is single symptom? Because see, for example, let me take fever. See, is that like only if you have sepsis you will have fever? No, right? Even if you have pneumonia, even if you have a normal viral fever, even if you have some digestion abnormality, all these things, fever is a common symptom. So if the patient is having fever in his or her chart, I can't assume that patient is having sepsis. So that is why I'm telling you, you should see more than three symptoms to code a condition. See, for example, two condition let us take. Okay, see, fever and WBC, increased WBC. This is also based on only fever and increased WBC. I can't go and take the sepsis condition. Why? We should have a common thinking that whenever an infection is there in the body, sepsis is a kind of infection. Okay, but there are many other infections such as like see, pneumonia, UTI, all these are infections only, but they are localized infection, means they affect only a particular organ. Okay, so these infections, whenever an infection is there in the human body, our body will increase the WBC count. Why it is increasing the WBC count? In order to fight the organisms. It is the first line of mechanism, defense mechanism in our body. Our body will release the n number of WBC so that it will go and fight the infection and stop there itself. It won't let inside. Even after WBC is fighting and it is not like dying or get killed, one day then it is going to cause some disease to us, okay, or infection to us. So if the patient is having only fever and increased WBC, I can't blindly go and take sepsis, because this fever and increased WBC can also be a symptom of pneumonia, cellulitis, or any other infection. Because whatever the infection is, whatever the organism is coming into my body, our body will obviously release the n number of WBC. Okay, so that is why if the patient is having, for example, fever, increased WBC, tachypnea, hypotension, and some metabolic acidosis, then obviously I can take sepsis. Means you can't yourself take sepsis. The provider should have told this patient have sepsis. Also the indicators which I have told you now, any of these 4 or 5 indicators, at least 4 to 5 indicators should be present to take a condition into consideration. Okay, so if the provider has already stated sepsis and this sepsis patient has these many 4 or 5 symptoms in common, then sure this patient has sepsis. Okay, we should remember that. Also one more thing, if the blood culture, see, first of all, sepsis is a systemic infection. Why it is called a systemic infection? Because it is the infection of the blood. Our blood is found in our body right from head to toe, right? So it is a systemic infection. As already I told you, these are all localized infection because it affects only a particular organ, whereas this affects the whole body. That is why this is a systemic infection. This is a localized infection. Okay, so you can ask me, why have you given the indicator as localized infection here? Sometimes, not sometimes, most of the times, from the localized infection only, systemic infection will occur or progress. For example, if the patient has UTI, if UTI is not treated in a proper way, that is urinary tract infection is not treated in a proper way, then from the urine, this organisms will go and infect the blood, causing the sepsis. Okay, so that is why from localized infection you will get a systemic infection. Okay, also um, See, if suppose there are many indicators of sepsis, but still the blood culture is not positive. It is not that if the blood culture is only positive, then you can take the sepsis. No, it is not like that. It is one such indicator for sepsis. Even if the blood culture is negative till date, NGTD they will give. Okay, no growth till date. That is NGTD. If you find such sentences, you should not go with the conclusion, okay, they are telling no growth till date, because they are mentioning no growth till date means till date there is no growth. Maybe the patient is already like initiated into antibiotics by the day of admission itself. After 5 days, if they are taking the blood culture and seeing, there won't be growth because the patient is already into antibiotics where it will go and kill the all the microbes in the blood, so it will show no growth sometimes. Okay, these are all the things you should keep in your mind. You should not blindly if you don't see a positive blood culture, or if they are going to say negative blood culture, don't blindly skip sepsis. Okay, it is not mandatory for coding sepsis the blood culture need to be always positive or the blood culture should always be present. No, nothing like that. It is one such indicator. Okay, and see, let us see all the other indicators. Tachypnea means this sepsis patient mostly they'll have rapid breathing. Tachy means fast, pnea means breathing. Tachycardia, tachy means fast, cardia means heart rate, something related to heart. So rapid breathing, rapid heart rate will be there, and increased WBC. Since it is an infection, our WBC will be going beyond like 12,000 mm, or sometimes it may go less than also, that is 4,000, which is abnormal. If it is above 12,000, abnormal. If it is less than 4,000, also abnormal. The sepsis patient, if it is getting worse and like septic shock, severe sepsis, then that patient may have confusion, disorientation, or altered mental status, which can even lead to encephalopathy. Okay, next is the hypotension. The patient's BP will become very low. For that, they will be treating with vasopressors. Okay, there are many vasopressors are there. We should see to the chart. Okay, before coming to a conclusion, if the patient has hypotension and this patient is treated with vasopressors and this patient already has sepsis, means there is a probability that this patient may have septic shock. May have, it is not necessary that always it should be present. Septic shock, if hypotension is present, septic shock should be present, nothing like that. It is like, it is an assumption. Sometimes if hypotension is there, okay, let me search for septic shock. Or else if you are working with CDA, that is clinical documentation improvement, okay, those sector, if you are working with those sector, you are the person who is going to initiate a query. So for that you need to know the clinical indicators very well. For those purpose, like patients know, if the patient have hypotension, they will question the provider whether this patient has septic shock, because hypotension is a very important indicator for septic shock. Also metabolic acidosis, some acute organ failure such as AKI, okay, and acute onset of confusion, shock, positive blood culture, localized infection. Oliguria means decreased urine output. If the patient, okay, why this is given? As I already told you, it is an infection. So if the provider has stated this patient has sepsis and also treated with IV broad spectrum or empirical antibiotic or some organ specific, organism specific antibiotic, then it means that this patient has sepsis and is treated for that condition with antibiotics. So it is a supporting clinical indicator. Also elevated procalcitonin, lactic acidosis, metabolic acidosis, all these conditions are a clinical indicator for sepsis. Okay, we need to understand this. And I wanted you people to make clear that not all these symptoms are necessary to code a condition. At least four, like I initially told you three. Sometimes it's not only three, it is at least 4 to 5 symptoms is needed to code a condition of sepsis. Okay, or to initiate a query for sepsis also, you need at least 4 to 5 indicators to confirm or cross verify the diagnosis which the provider has already given in the chart. For that also we need the clinical indicators. Just like that, you can't go and code a condition in an inpatient chart. Okay, So this is all about sepsis, guys. If you have any doubt in any of the chapter and you want me to describe it, okay, in the upcoming videos, you can put it in the comment section so that if I see that, I will be going based on that. Okay, so let us meet in the upcoming sessions, guys. Please do like, share, and subscribe to my channel, guys. Happy coding. Thank you.